Thank you, Representative. Further discussion. Representative Prusak.
Thank you, Madam Speaker. To the bill.
To the bill.
Colleagues, the issue of Medicaid funding is one that has been very close to me for the last 2 years, both on a personal and a professional level. The Medicaid funding package that passed on this floor in 2017 and the ensuing fight over Measure 101 was a major reason that I decided to run for office in the first place. For the 6 months that followed, I was proud to stand for the nearly 1 million Oregonians who depend on Medicaid to provide them with quality, affordable health care. And for me, this is not just words on paper. I see with my own eyes the real-life effects of Medicaid. I work daily with patients who are often in the last years of their life. I see people at their most vulnerable. I am often both caregiver and confidant for patients and their families. We talk about their lives, what brings them joy. We talk about the fears, and I work hard to give them hope. Medicaid makes it possible for Oregonians from all walks of life to get access to health care in times of need. Each of us on this floor today knows someone who turned to Medicaid to care for themselves or loved ones. As a nurse practitioner, I see how Medicaid saves lives, but as a daughter, I also saw it save my father. When I was young, my father was diagnosed with cancer, and to survive, he depended on Medicaid. I believe House Bill 2010 will provide the certainty that my patients and every Medicaid recipient needs. This is a reasonable, responsible bill that builds on the work this legislature began in 2017 and will ultimately provide years of stability. And finally, not least of all, it is what Oregonians have told us they want. The desire for quality, affordable health care is something that transcends parties and any urban and rural divide. I am proud to stand before you, colleagues, in support of this legislation. I hope you will join me in voting yes today. Thank you.